Assalamu alaikum. Another history scenario is Jainab is 11 years old girl has been complained for recurrent headache and started 7 months ago, and now this headache causing school absence. She has good school performance. Growing is just above 78 centile and height is 50 cm. He is referred from GP regarding her complaint. Initial assessment in the referral shows normal. So, hello, good morning. This is Dr. Roxana, one of child and adolescent doctor here. Am I speaking to Jainab? And are you Jainab? And Jainab's mom, how are you? How can I address you? Thank you for coming. Today I have made this arrangement to take you history about Jainab's health condition. Is it the proper time? So, mom, during this session I will take some notes. Is it okay with you? Okay, so will you please tell me what is your main concern? And then she will describe that her child has headache. In the headache history, as is a descriptive type of question. So in the history, we're looking for what is the site and onset of these characteristics of this and this radiation of this headache, aggravating factor, relevant factor, how severe it is it associated with other symptoms or not. So if in the discussion we don't get these points, then specifically we will ask what is the site of this, how he feel, does she ever complain, how he feel during the attack, and does it remain in the same place or go any other portion of the head, and does anything make it better, how does anything make it worse, does it have any time preference, any time of the days it becomes more worsening, and how severe it is. If I tell you so to give the marking where 1 is the less and 10 is the most severe headache, so how can you give mark to her headache? And after this, what is this headache, does she feel anything before the attack, how she describe her headache, and after that, is this headache associated with any kind of vomiting, and any kind of throwing up, and then we will ask for how severe it is. She may mention that following this headache, now she is causes absence of school, and then we will go for the constitutional symptoms. And the constitutional symptoms will be, do you have any concern regarding her weight, does she have any kind of fever, what's about her activity, and now I'm going to ask severe symptoms of different parts of body, trying to look out is it present with her or not, does she complain any kind of visual problem, any kind of eye change you notice nowadays, and any change, any kind of feats, any weakness of any side of the body, do you notice any personality change or mood swings of um, your baby, any kinds of palpitation, do you ever measure her blood pressure, any cough, any breathing difficulty, any skin lesion, any concern regarding increase in head size, any gait problem, do you notice? Any tummy pain does she ever complain of? And then we will ask for past medical illness, any time, any kind of long extending illness, any need of hospitalization, and what do you do so far for the headache? How many medication? How many days? What is the compliance? And does she need undergo any kind of surgery, and any trauma especially on the head region, and then history of perinatal history, just in one line. Do you have any concern regarding her birth period? And then do you have any concern regarding his growth? How about his school as his 11 years old, and does she receive all of these jabs? Does she has any kind of allergy to any kind of medication or any kind of food? And can you describe your family? What is the family environment? And does your family has any kind of this type of illness? Okay. And then social history, what do you do for your living? Is it satisfactory? Do you need any kind of extra help? Is any family issue surrounding that may cause stress to your child? How about her school performance? Do you feel any kind of bullying in school? And after this, what is your biggest worry? And then what is your expectation from us? You want to add anything in our discussion that you feel necessary to add? Okay, thank you for your time with me. Okay. Today, I took history of Jainab, 11 years old. She presents with headache for last 7 months. The headache is recurrent and throbbing in nature, associated sometimes with vomiting, and there is no history of visual change, weight loss, or personality change, and no early morning headache, but there is a family history of migraine is present, and Jainab has a social issue that parents are forcing her to change her school. So considering all this, this may be a case of migraine, uh, stress, headache, intracranial space occupying lesion, idiopathic intracranial hypertension, medication over use headache. So if it is a case of migraine, migraine is recurrent migraine is a pulsatile pain, and it relieves by sleeps associated maybe with aura, photophobia, phonophobia, and eating chocolate and tummy pain is present. And another is the over use of medication. Overuse of medication here it occurs due to medication overuse occur in 15 or more days per month, due to, and there is a history of frequent use of analgesia. Headache occurs 2 days per week, and there is which is usually associated who has the migraine, and withdrawal of the medication will remove the symptoms within 2 weeks. And now the management, acute management, and long term management. Acute management, first of all, the medication in simple analgesia, sometimes prophylactic medication may be needed, and this is a simple analgesia, paracetamol, NSAID, and sometimes sumatriptan nasal spray, and prophylactic propanolol. And there is some long-term management, reassurance, removal of the exacerbating factor, lifestyle modification and dietary advice, headache and food diary to capture the exacerbating factor, and anti-migraine drug may be need of dietitian, and in acute case there may be some cold compression or ice compression. And now one of the differential diagnosis here is brain tumor. So brain tumor usually presents the symptoms headache, gait abnormality, percentage change, seizure, sign of raised intracranial pressure, early morning headache with vomiting, and this headache usually increase when there is straining. And types of brain tumor: supratentorial, infratentorial. Supratentorial astrocytoma, craniopharyngioma, and infratentorial below the tentorium, tentorium cerebri. This is cerebellar medulloblastoma, astrocytoma, ependymoma, brainstem glioma. and spinal cord astrocytoma ependyma. About 60% brain tumor is infertentorial, and treatment option is surgery, chemotherapy, radiotherapy, and multidisciplinary team approach, physiotherapy, occupational therapy, speech and language therapies. All this after surgery. Thank you.